Live from WBFF in Baltimore, this is Fox 45 Morning News.
Well, are you ready for snow and the ice and all the hazards that come with them? How you can prevent wintertime injuries. January and February often means snow and ice around Maryland. Make sure that you are ready for it. Dr. Mark Slabaugh is a sport medicine surgeon with Mercy Medical Center and is joining us now. Doctor, Happy New Year.
Happy New Year to you. Thanks for having me on.
Sure, yeah, winter months, you know, and I mean, of course, you're thinking about this snow, but really it's the ice. Common wintertime injuries that you typically see.
Anything that involves ice, unfortunately, you're worried about fractures, especially as we age. That becomes very common. Distal radius or wrist fractures, and then also hip fractures. And then if people land on their shoulder, oftentimes we'll see what we call proximal humerus or shoulder fractures in these individuals that unfortunately slip. You can't control how you fall, and you might fall on your hip, you might fall on your wrist, or you might fall on your shoulder. And so those are the three most common injuries that we typically see during the winter months when they slip on the ice.
And as a surgeon, you may see some patients that should have come in months ago, but they really didn't realize they had a break.
Yeah, absolutely. A lot of times people, they'll just sort of blow it off. They'll say, oh, this is going to get better with, 3 or 4 months of just rest, and then it's not getting better. And so we really recommend, especially if you've fallen on the ice, had a hard fall, you can't walk, you can't put weight on it, or you can't move your shoulder or your wrist, you need to come in and see us sooner rather than later.
Dr. Slabaugh, do you see any injuries that are typical with age groups where you're like, oh, you're getting to be about that age? Do you ever have to say that to some patients?
Typically in the winter months when you're seeing these injuries, when they've fallen, it's almost always elderly patients, people that have osteoporosis. They haven't been eating enough calcium or getting enough vitamin D in their diets. And unfortunately, by the time you recognize that, it's too late because they've already had those fractures. So one of the things you can do to prevent these type of fractures, especially in the younger ages, is to make sure that you're getting enough calcium and vitamin D. Those are the two most critical things that you have to take in order to prevent these type of fractures later on in your life.
Yeah, it's amazing when you bring up younger patients here, too. A lot of them go to social media and they get their advice off of that on ways to get around injuries. They don't want to go and speak actually with the doctor or go to the office. Do you see that? Are you seeing that? Or is that just something that we're seeing kind of like more on a local area?
I think that most patients, if they do see stuff on most social media, then they're going to come in and see us. Most of the social media channels are really encouraging you to get into to see a doctor, especially for the knee injuries. I'm a sports medicine surgeon. Somebody is playing soccer, tears their ACL. Those patients are coming in very quickly because they know that they can't get back to the sports that they love.
Yeah, and then when you're talking about the ACLs, the knees, the ankles with youngers, what about patients? How long of patients do they need for those recoveries to be 100% back on the field?
Unfortunately, a lot of patients feel like surgery is a quick fix and it's going to get them back very quickly, but unfortunately, you can't work faster than the body can heal itself. So a lot of times, these are 6 to 9 month recoveries, especially if you have to do surgery.
Dr. Mark Slabaugh with Mercy Medical, surgeon there. Thank you so much. We appreciate your expertise. And again, Happy New 2025.
Happy New Year to you. Thanks very much for having me on. Have a wonderful new year.
You too.